The patient is smarter than a lot of places give him credit for being. It's impossible to do surgery and have a scarless result. A scar is the body's response to an injury, which that's what surgery is. Now, done properly, you know, results can be minimally visible, or they can be almost invisible, but never scarless. The two methods of donor harvesting, we have number one, the strip method, and number two, the follicular unit extraction. In the strip method, the scar is determined by the length and the width, you know, of the scar. So the area of scar, usually in our practice, scars are very minimally visible. There's several examples here of strip scars resulting from strip. And you can see that they measure between 0.1 usually on the good ones, sometimes a little less than 0.1 millimeter. And the bigger ones are probably 0.2. Rarely do I see one larger than that. In the strip method, it's very important to minimize post-surgery the amount of tension on the wound. Tension will tend to stretch an immature scar. It takes about 6 to 12 months for a scar to mature. And if tension is minimized, then you will get the nice scars that you see in all these strip procedures that I've done recently. The FUE procedure leaves a punctate scar because one uses a punch that's usually about 1 millimeter punch. That will leave you a scar that has a 1 millimeter diameter. To calculate how much scar is left with a FUE procedure, you have to calculate the area individually. So the area is determined by pi times radius square. Using the 1 millimeter punch, you have a radius that's 0.5. So each scar will be about 0.8 millimeters square. If one has to multiply that by the number of extractions that were done in a procedure of 3,500 grafts, follicles, that would represent an area of about 2,800 millimeters square. So in conclusion, one usually has much more, anywhere between 7 to 14 times more scar with FUE than with strip, done in good hands.